We got you.
apologize. At least you were able to hear me. Okay, we're gonna just start where I left off. We are seeing daily cases rise in Denver again. Not dramatically like we are seeing in states and cities around the country, but we are going in the wrong direction, and that is of concern to us. The good news is that our hospitalizations are still generally low. They remain flat, and so our capacity in the hospital is in pretty good shape. The bad news, the last time I updated you on our COVID impacts, our positivity rate was around 3%. And today, or at least as of July the 3rd, we set at 4.5%. That is not good. We are going in the wrong direction with regards to our positivity rate. That means that we have, with our increased testing here in Denver, cases have gone up. But the part that is worrisome, again, is the slight increase in the positivity rate we have in the city. Despite what our occupant in the White House has said, there is no harmless COVID case. And we want to make it very clear. It's a concern for everyone because even mild cases or asymptomatic cases can lead to infection and death of others in our community. So these numbers are concerning, and I urge everyone in Denver and throughout the state to pay very close attention because we have lost a little ground in our fight against COVID-19. Now, many of you know that I, in my younger years, wanted to be a sports newscaster or announcer. And so I'm going to use an analogy, and this goes to pre-COVID when I used to sit and watch the Denver Nuggets, and I would watch a very talented team work very hard to really take command and to grab momentum in the game, only to let up and to not be as focused as they were at the start of the game and to lose that momentum and have to fight like hell to get back on top of the game. We cannot amplify enough that this is the time for us to not lose the momentum that we've all fought and sacrificed so hard to gain, and to make sure that we maintain control of our battle with COVID-19. And I ask, and I'm really appealing to the public to listen to what the governor said yesterday, because we are very much aligned with his message and his values. Don't gather in large groups. Keep your personal social interactions to as few as possible. And when you do gather with groups, keep them as small as possible. And then we got to simply say this again. I know it sounds like a broken record, so let me try a little differently. Hashtag cover up. Hashtag mask up. It's not a political statement. The reality, again, when you wear a mask, you are demonstrating care for those who are around you. And reality is, and statistics continue to prove it time and time again, is the best way, the greatest tool we have to help combat the transmission of COVID-19 in our community. I want to tell you that in the last 2 weeks, we have seen a 60% jump in complaints to our Department of Public Health and Environment about face coverings. Investigators are also seeing an increase in non-compliance as more of our businesses open and residents get the impression that life is returning to normal. I want to say this very clearly, and please hear me. Face coverings are required in Denver. The order has not been relaxed, has not gone away. I'm going to say it one more time. Face coverings are required in Denver. We've updated our face covering order to better align with state guidance. Here's what we need to know. And I'm going to be very in the weeds right now and a bit boring, but this is important since people have a lot of questions about face coverings. And I think it's important that we touch base on these issues. Face covering is now required when you're inside, attending, or in line to enter any indoor or outdoor business or event. When you're inside or in line to enter any government offices or facilities. They're required at limited healthcare operations or personal services or at healthcare operations unless directed otherwise by an employee, because the healthcare or personal services that are being provided require removal of the face covering. They're required in common areas of an apartment building, condominium, or similar buildings. And that includes lobbies, in the pool areas, elevators, offices, and spaces used by the public unless you are swimming or exercising. We ask you to wear your face covering when you walk into or around a restaurant or bar. Of course, you may remove the face covering once you are seated at the table, eating and drinking. We are beginning to see more live performances take place, and that's a good thing. And we recognize that everyone has limitations within the public spaces, but for our performers, you must maintain 25-foot distance between the attendees, our patrons, and at least 6-foot distance from each other while on stage, and other employees at all times during your performance. You don't have to wear, of course, a face covering while you're performing, but once you stop performing, you must put the face covering back on. We've got to keep doing our part, and this is for all of us, to keep this pandemic at bay. And while Denver's had the order for a while, we're not the only city in the region requiring face coverings, and that's a very important and positive thing, since people aren't just staying in their own cities. And so I want to take time to thank my regional affairs team, Jordan Sowers, and our public health teams who helped to rally regional mayors to call on our neighboring public health departments to implement face cover orders in their cities and their jurisdictions. I want to thank the other mayors, about 14 other mayors, who signed on to that letter and said this is extremely important for us all. If we're going to get through this together, we're going to have to be together on these very important orders. Here's why not gathering large groups and not wearing face covering is so serious. Because if we see confirmed cases start doubling over 2 weeks, or our positivity rate reaches 7%, hospitalization rates increase to 20%, and we're at 11% as of July the 3rd. And hospital capacity reaches 90% occupied, and today we're at 72%. What will happen when we see those type of metrics beginning to occur in our city? We'll have to seriously consider pausing or even rolling back our reopening. That will be absolutely devastating to our economy, maybe even more so than when we had to freeze the economy back in March. To roll back and to close again would absolutely topple many of our businesses, and we simply want to avoid that, want to avoid more job losses in our economy, particularly when we've worked so hard to grab this momentum and to get on the other side of this curve. No one wants to pause or go backwards. In addition to face covering, of course, we ask everyone to continue social distancing and frequent hand washing, and of course, the other tool we have available to us in the fight of COVID is testing. In the absence of a national strategy, and trust me, we do not have one, on testing, states and cities have had to develop our own efforts, and I'm proud of what we've done in Denver, and I'm proud of what we've done in Colorado. But let's be very clear and make no mistakes about it. We need a national strategy on testing and on our confrontation with COVID-19. We need national leadership on this issue. And right now, the United States of America is without leadership on this issue. And it is no surprise that we are leading the globe in terms of our infection rates, our death rates, and of course, hospitalization as a result of COVID-19. So here's an update on our testing. Demand at Pepsi Center, the site is open until we have reached 2,000 tests on each day. We are seeing, of course, increased demand for tests nationwide, limiting supply, and we are not immune to that. And as you saw last week, the governor and the state helped us out with the appropriation of 10,000 tests. It's also slowing down the results. We have a backlog of the tests results getting out to people. And so that's why we've capped it at 2,000, because we want to make sure that we get back to people in a timely manner and not overwhelm our labs and create an even further or bigger backlog. So we're working with our lab partners to speed up our results. Citywide, we've averaged well over 10,000 tests a week, and that's ahead of the average that we should be at. And so we're doing a phenomenal job with regards to testing. So that the future of the Pepsi Center site, Obviously, we have supported the establishment and setup of this site with our CARES Act, our FEMA funding, which is limited. But we are right now working with the state to determine the future and continue operations and management of the site, and expect to share these details in a coordinated way later today or earlier next week. Early next week. COVID-19 has posed unique challenges for those experiencing homelessness, as we all know, and I want to make sure we give everyone an update on this effort as well. So I'm going to turn it over to Britta Fisher, our Director of Housing and Homelessness in the City of Denver. Britta?
Thank you, sir. Good morning, everyone, and I want to start by saying a continued thanks to our many shelter and service providers for helping us stand in the gap that COVID created. Through our response strategy, we're continuing to make a significant difference for persons experiencing homelessness and helping to ensure public health throughout the community. So far at the National Western Complex, we have served more than 3,000 unique clients with a nightly average of 668 guests. At the Denver Coliseum, we have served 774 unique clients with a nightly average of 169 guests. That's also at the auxiliary shelters, more than 200,000 meals that have been served to people experiencing homelessness. We're in negotiations to extend the auxiliary shelter at the National Western through August 15th. We anticipate bringing an amended licensing agreement to City Council very soon. We're working to ensure continued availability of sheltering options with adequate physical distancing throughout the pandemic. That's why we've set up many of these additional sites. We're working to reconfigure the space within our existing shelters, our auxiliary shelters, and the hotel and motel rooms in order to meet these needs. We are also all aware that we have seen an increase in camping in our neighborhoods and throughout the city. We have increased our outreach to encampments with a very strong focus on Maury Middle School. We are led through our contracted partners with the Denver Street Outreach Collaborative. And if you're not familiar with that collaborative, that includes Urban Peak, St. Francis Center, and Colorado Coalition for the Homeless. We have a very strong human services focus of getting people inside and into motel and hotel rooms. Through the outreach this week alone, we have moved 9 people from Maury into hotel motel rooms, including 6 into protective action rooms designated for people who are more vulnerable to COVID, and 3 into activated respite rooms for those who need to medically isolate. This is not just our approach at Maury, but throughout the community to really ensure that we are utilizing the resources that we've set up through our hotel rooms. We have more than 800 that we have contracted, and to identify people for protective action. If you think back to the early days of this crisis, we had that emphasis on that medical isolation focus because we were seeing such a surge in cases. Right now, it's really on that protective focus to help get people who are over the age of 65 and with underlying health conditions into those rooms. We also have the Colorado Village Collaborative helping us with outreach in this role, as they also focus on a safe outdoor space and getting that set up. So with that brief update, I would like to toss it back to Mayor Hancock.
Thank you, Britta. Before we go to the questions, I want to just speak briefly to the condition of the city, our public spaces and efforts that are underway to repair some of the damage to our buildings in the aftermath of the George Floyd protest. Now, in the coming weeks, you're going to continue to see us to our very aggressive efforts to remove graffiti, have our buildings restored and windows replaced. Some of them are being done today. I noticed that several buildings here at City Hall have already been replaced. And in the coming briefings, we're going to update you on the progress we are making on the tasks identified in our long-term recovery plan, not only economically, but a lot of the work that we're doing behind the scenes and some of the questions that our public, of course, has asked us as a city to address. It's important for Denver to know that this work is underway, and we will share in future briefings the update on the work that is being done. So with that, I think we're going to go ahead, Teresa, and open it up for question and answer.
Thanks, Mayor. And I'll go ahead and watch for hands to go up. So if you could use that that taskbar with your cursor and raise your hand. No, it's okay, Esteban. If you have a question, go ahead and you can go.
Yeah.
Hi,
Mayor.
Esteban, go ahead and kick us off, and you can turn your cameras on for the questions, and I'll monitor questions. Go ahead.
Hi, Mayor Hancock. This is Esteban with Denver and Colorado Public Radio. I was hoping to get an update on some of the community testing sites. What kind of feedback has the city received on that, and how many tests are being provided in some of these sites, specifically the ones that are serving some of the underserved communities in Latino and Black neighborhoods?
I appreciate that, Esteban. I know we're right now out in Montbello with a site, but I'm going to ask Bob McDonald and Murphy Robinson, Director of Safety. Bob is our Executive Director of Health and Environment, to speak on the testing, as well as Murphy Robinson, who has spearheaded the effort to open up the Pepsi site. Let's start with Bob in terms of the other sites that we have.
Yeah, thank you, Mayor, and thank you for the question. You know, very early on, trying to protect our most vulnerable communities was a focus for this department, Department of Safety, and so many others, the mayor's office, so many other partners throughout the city. And we continue to be one of the only health departments in the nation that provide a mobile service that will go to underserved communities, to go to individuals that are struggling at their door, to take that test for them, get it processed, and get the results back to them, all without them having to leave their home. We are doing hundreds of tests a week from our mobile program. And when you add in the additional sites that are being stood up in underserved communities, it's over 1,000 tests a week being done. So I don't have the data for each site that is being, how many tests are being done at each site, but it continues to climb every week. It's going to continue to be a focus of ours all throughout the pandemic.
Murphy?
Yes, sir. You know, I would also add to what Bob has said, the incredible work that our team has done, but also the work that our partners are doing with Denver Public Health and Denver Health to stand up community testing sites. We continue to really look at the data to understand what are the populations and underserved communities that need these tests, but also how do we make sure we can ignite some of our community partners to do some of this testing. I had a call today with Denver Health this morning to talk about 4 other sites that they're standing up. And so that partnership is vital, along with what we are doing at the Pepsi Center and on our mobile sites Bob talked about.
Yeah, I saw Liz Gallardi pop up. Liz, did you want to add some thoughts to that as well? Have you introduce yourself? You're on mute, Liz. Are you up?
It's the pressure, Mayor.
Sorry, I was trying to ask a related question. I don't know if now is a good time.
Oh, okay. Go for it.
I was just wondering if there is an update on the search for a safe open space. And also, I know saying that 9 people were removed from Morey Middle School. Obviously, there's a lot more people than just 9. So what's the long-term plan in terms of potentially moving people from that site?
Yeah, we are working steadily on removing and helping to reestablish those individuals. Let me turn it over to Britta Fisher, who can give you a more detailed update.
Thanks for that question, Liz. You know, that was just from a day and a half of outreach, and we're out there every day. And so that was just an example of some of the progress. And our goal is to rehouse and help people access as many of the rooms as possible. And like I said, it's not just at Morey, but that was an example because I know there's a lot of attention there right now. As far as the safe outdoor space, Bob McDonald is also on here, and our agencies across the city are working with the proposers at Colorado Village Collaborative on what a first space looks like and what kind of permitting and other things that will be needed. And so we're working through those things right now, and we'll have more to say soon.
Thanks, Britta. I'm looking for any more questions. Anybody else in the queue, or are there any other questions on what we shared today? Got a few more minutes, so if there's anything else, please go ahead and raise your hand, turn on your camera, and we'll get your question answered. And if not, we can wrap up a little bit early. Esteban, go ahead.
Yeah, I was wondering, Mayor Hancock, if you wanted to comment on sheriff's deputies being able to carry out evictions in Denver again. If you had any thoughts about that, and if you think that's a good idea right now where people are still struggling because of the pandemic?
Listen, first of all, thank you, Esteban. It's a very good question. This is it's a difficult situation, obviously, for all of us in Colorado, and of course across the country right now, as people continue to struggle as a part of this economy. However, evictions are a matter of state law, and the governor's moratorium expired in June. And so when the governor didn't extend the moratorium, some of the property owners began to move forward with filing their eviction proceedings. And so we are aligning ourselves with what has happened, of course, with the governor and the state's direction. But I will also share this, and I think it's important to note, the city has established numerous programs that are designed to help renters who may find themselves in this situation. And we ask you all to write about those and talk about them and encourage them to reach out to the city. We have TRUA, which is our temporary rental utility assistance program. We have an eviction assistance effort to help people and other legal services. And we're working on some other things, but we do have some established programs to help folks who find themselves in a situation. It's a very difficult situation because it's a whole system that has to be addressed. In terms of eviction, landlords have mortgage companies, they have mortgages that they have to be mindful of. And unfortunately, Esteban, we've had some situations where individuals who have not lost their jobs and are able to pay their rent have taken advantage of this moratorium unfairly during this time. And so we see some of those situations and unable to, and really not our place or role to dissect who is truly in trouble, who isn't. Aligning ourselves with the state policy is the thing we had to do at this point in time.
And I wanted to, Mayor, bring Bob McDonald in too on that a little bit, because I think he might want to add a little something about, just the overall harm reduction efforts underway. Go ahead, Bob.
Yeah, thank you. And I get a lot of questions about that. Why now? Why a supervised site now? Or not supervised site. Well, it is a supervised outdoor space. Why now? And, listen, we're in some unprecedented times here. And I want to be straight here that I will never be in a position where I can say, all things being equal, that it's safer to live outdoors than it is safer to live indoors and take advantage of the sheltering system that we have with our many partners. But we are battling a number of public health issues here, not just COVID-19, but also the environmental and the public health concerns that stem from some of the encampments that we're seeing. So we followed CDC's guidelines every step of the way, and I keep getting this question. CDC guidelines say that encampments shouldn't be disturbed right now. Well, their website does say that. We've also spoken directly to them, and they've acknowledged that when encampments present the types of concerns that we're seeing, we need to balance our efforts between COVID-19 and those public health risks. And I want to take an opportunity to remind everyone that we have seen outbreaks in encampment settings. We've been battling a hepatitis A outbreak for many, many months now. We have had over 100 cases to date, and we are seeing the early signs of a potential another type of bacterial outbreak. So this supervised outdoor safe space is a temporary harm reduction matter as we get through these public health challenges, these unprecedented challenges that we're seeing. So.
Bob, thanks. And I know Vicente had a question, and I'm trying to see if we can get him off of mute. It's the 566 number. Let me see if we can find you, Vicente. Chelsea, do we have him? Vicente, try to talk to us and let's see if we can hear you. Let's see. Do we have you? Okay, we'll figure that out, Vicente. We're figuring it out now. Libby, why don't you go ahead with your question?
Hi, this is Libby Smith with CBS4. A 4.5% positivity rate is concerning. The World Health Organization says a 5% positivity rate is concerning. So at what point would the positivity rate need to be for you to enact further restrictions?
That'd be a great question. Let's have Bob address the positivity rate and its implications.
Yeah, that's that one has a lot of nuances to it, that particular metric, because a lot of it has to do with how much testing we're doing. The more testing we do, the more likely it is that we're going to pick up on asymptomatic cases. And then, who's coming to the Pepsi Center? If we're focusing on, because of limitations with testing supplies, if we focus on testing of those that are asymptomatic, I'm sorry, those that are symptomatic or those that have been exposed, the positivity rate's going to go up. And so that by itself is not the metric that drives the decision making, because a lot of it has to do with who is showing up to the Pepsi Center and other sites. Again, if we're focusing just on those that are symptomatic or have been exposed, the positivity rate is going to go up. If we have enough testing supplies to test everybody who'd like to get a test, then that positivity rate's going to go down. So it is just one of many metrics. 7% positivity rate for that particular metric would be a concern, but we would compare that with all the other metrics to make a well-balanced decision.
And those metrics are hospitalizations, obviously, death rates that are occurring. And Libby, to your question from a policymaker position, and obviously you see I'm surrounded by very smart people, including Bob and many of his scientists and many at Denver Health who are advising, leaning in. From a policy perspective, obviously, whenever we see a trend going in the wrong direction, and we see it for a sustained period of time, maybe over a 2-week period, that becomes very concerning to me, and if I see non-compliance or people who are breaking the rules in terms of allowing too many people in their social space or their public space, like bars or restaurants, people not wearing masks, that's where we have to, make some very difficult decisions. And I want to just repeat, if we have to roll back and shut this economy down again, it will be absolutely devastating. The first phase was very devastating. We saw the number of jobs that were lost. We saw the devastation of people's lives. We are still dealing with that. This would be like a wound that you received treatment for, and you've not listened to the doctor, and now you have to go back in and re-break a leg or what have you to begin to get it to heal again. It would just absolutely be devastating. And I hope we do not have to do that. We need people to comply. We need people to get tested. We need people to wear face coverings, wash hands, social distance, and simply be smart about this.
Mayor, we figured out the problem with Vicente. It was my lack of instruction. So if you are on the phone, we need you to *6 to unmute yourself. Vicente, go ahead with your question.
Okay, thank you, Teresa, and thank you, Mr. Mayor, for taking the time to do this news conference. Question about the face coverings. There has been much said about face coverings with the governor yesterday and you today. Is there anything that the city of Denver will do to step up the enforcement of the requirement for face coverings? Will you do more, perhaps have officers issue more citations and become more aggressive in enforcing people to wear masks around the city?
I'll let Bob again chime in this, but I can tell you in our consultation and when we've tried to respond to residents, and what I love about what's happening in Denver is you actually have residents who are saying, listen, I walked into a store, I saw people without masks. Our job is now to go and address the management. And I think Bob can talk about that, but we try to move in and address the management because, that's where we can gain greater and quicker compliance. Bob?
Yeah, thank you, Mayor. And thank you again for the question. It was mentioned earlier that we just revised our face covering order, and I want to share that we've also reinforced within that face covering order that individuals can be held responsible. It is unlawful not to wear a face covering, and I hear a lot of things about face coverings in terms of, well, it's political. I've even heard people saying I have a right not to wear it. I've heard people say they're not masculine, they're hot, they're frustrating when you go someplace and you forgot to carry it with you, and so you have to go back home and get it. Listen, we all need to pull together here and protect each other. Do the right thing. As humans, we need to watch out for each other in these stressful times. please wear that face covering. We are going to ramp up enforcement. Our goal is compliance, and we always look to education first and warnings first. But our staff members will issue a summons if need be to gain compliance. So as individuals, please wear those face coverings. We don't want to reverse course here. Wear those face coverings, be diligent. To our business owners, thank you for being so diligent. We need you to keep being diligent at the door when your patrons are coming in. Remind them they need to put their face coverings on. We don't want to conduct enforcement, but if that's what we need to do to gain a high level of compliance, that's what we're going to do.
Let me add to this, because Bob makes a point, Vicente, that I think is very important, and we got to address it. This is not a political or partisan issue. We do not report cases based on party. You don't hear that 40% of the positive cases are Democrat, 42 are Republican, and 15% are unaffiliated. The reality is that this is about humanity. We do report based on those who tend to be more vulnerable, based on age, as well as, unfortunately, culturally. And the reality is that we've got to stop playing this silly game of partisan politics. And this is the void in national leadership that I was alluding to. I learned a long time ago as an elected official what I say matters. And that if I talk about the importance of wearing masks, you're going to find a lot of people are going to say, well, it must be important for us to wear masks. But when we got on a national level, a conversation says, I don't think it's cool, it doesn't let me be masculine, well, then that's your own insecurity. It has nothing to do with the rest of Americans who simply need to hear a message of hope and a message of leadership and opportunity. And that message is this: we all are going to be healthier and better going forward if we wear masks today. We got to do what we have to do today so we can do what we want to do tomorrow. And that's the national message we need. And that's what you hear mayors repeating. Those governors that follow that message are the same governors today that we are seeing on TV who are having to explain the amazing spikes that are occurring in their states. Those mayors who didn't follow the mask recommendation are the same mayors are having to explain the massive spikes that are taking place in their cities. And so if we're all going to get through this together, then we're all going to have to be together on this message of wearing your face covering. It's the simplest, easiest way to demonstrate your care for those around you, as well for them to demonstrate their care for you.
Mayor, thanks. And I want to be respectful and keep us on time, but because we didn't get to everybody on the phone, I just want to do one last call for anyone on the phone who might need to *6 to unmute themselves. One last call for a last question. Anyone who didn't get to do that because they were muted.
Hey, yeah, it's Jesse Paul at the Colorado Sun. I wanted to see how the contact tracing is going for the city, if you guys have been able to keep up with the positive tests in the state, and, or if you're overwhelmed or need more resources or anything like that.
Bob?
Yeah, no, we are keeping up, but we want to be able to continue to keep up. So all the more important to adhere to everything that we've been saying this morning with face coverings and physical distancing. The more cases we have, the more contacts we have, the more difficult it is to keep up. But we are not overwhelmed right now. I do want to stress, though, to everyone, please pick up the phone, look at your text messages, respond to your emails. We're making every effort to contact everyone who may have been exposed. We are not going to ask personal information. We're not going to ask for your social security number. We're not going to ask for financial information. That's not what we do. We're very conservative with the information that we ask, very confidential with the information that we share. So if you are dealing with any of our case managers, please tell us who you've been in contact with. We're going to reach out to those contacts, and we're not going to give them your name as somebody who is positive. We're going to let them know that they might have been exposed. We're not going to share by who. And again, we're not going to divulge any personal information or ask for personal information. We're just going to ask that you follow the protocol so that you as a contact don't spread it to somebody else. So please work with us here when we reach out to you. Call us back, text us back, email us back. We're going to do everything we can to support you if you are somebody who's been exposed and you need to isolate for a while.
Thank you all. Mayor, any final words before we say goodbye?
I want to just thank everybody for joining us. Again, we're going to try to keep a regular update going because we still have very important things we need to keep the public apprised of going forward. So thank you all and have a great weekend.